Okay, this is my servant leader interview, and I have Dan Lukovic here with me from St. Francis Hospital, and he's going to give us a small background of his nursing career and when he became the supervisor in the acute unit.
So my name is Dan Lukovic, and I give permission for this interview. I've actually been working in the dialysis setting for 7 years. I've been a nurse for 4 years, registered nurse for 4 years, and also have been a supervisor in the inpatient acute care setting in the dialysis unit in the hospital for the past year.
Okay, we're going to talk about your role as a leader, and what do you think you can do in your leadership role to empower others that you work with?
So one of my leadership styles is a servant leader in which I work on participating in or building professional relationships with my coworkers as well as with the patients, doing continuing education, advocating for improved patient-nurse and staff ratios, or patient ratios, as well as improving communication skills and listening skills and collaboration with doctors and dietitians in order to improve patient outcomes.
Okay. Well, how would you define a servant leader in general?
A servant leader, I think, is going to be one of those leaders that's in the trenches with the coworkers and focusing on building those professional relationships and developing skills. At the same time, always looking for ways to improve standards of practice within that are specific to the unit, as well as collaboration with other professional types of workers as far as dietitians or nephrologists, and looking also at how what are bringing those patients in. Is it something in the community? Is there issues with patients that are getting in fluid overload? Are they being readmitted? And those are important things to consider as developing a holistic type of nursing practice.
Okay. What are some of your personal leadership strengths and qualities that you have?
Yeah, I feel like it's important to listen to my coworkers. It's important to build teamwork. It's also important to have the nurses be engaged within the practice and within making decisions that will change practices or improve standards of practice within the unit, as well as collaborating with other health professionals.
Okay, and with your staff members, how do you, or what role do you allow them to play in collaborating on decision making?
Yeah, so we have, we definitely open to suggestions. We like that those suggestions are backed with evidence-based research. We'll do monthly staff meetings. We'll do shared governance meetings, which each staff member will participate in, and we also do continuing education. So, and we rotate that continuing education meeting every month, so that each nurse can pick a topic that's specific to the unit and can bring some information to the rest of us in order to make improvements to the unit as far as improving patient safety, improving processes, and improving patient outcomes.
Do you allow staff members to meet their full potential, and how do you accomplish this goal?
Yes, so we definitely, in this day and age where it's important to have a bachelor's of nursing within the nursing, at least within the nursing profession, we promote and advocate for continuing education, as well as recommend and set time aside to promote credentialing, such as the National Kidney Foundation will do nursing certification or nephrology certification and hemodialysis certification, and the nurses are able to become certified within those areas to make more of a difference in those in that setting.
Okay. Well, how do you, as a servant leader, meet the needs of individuals while continuing to meet group needs as well?
So we'll do one-on-one type of meetings. We do yearly evaluations or every 6 months evaluations in order to take a look and see what individual issues may be coming up, and then we look at those as a group after as we try to communicate one-on-one with those issues. But the collaborative, our unit's a very small unit, and we're we are very open with each other about what things might need to be improved on, and so that helps. Another issue that we, a way that we look at things is we use situational leadership. So we'll take an event and we'll break that process down. It doesn't have to necessarily be an adverse event. We can look at how something has worked well versus how something is not working as well. And then, so I like to apply situational leadership to a lot of different aspects of the issues that come up, or that can come up with hemodialysis patients. We do hemodialysis in the unit, but then we also do continuous renal replacement therapy on those critically ill patients in the ICU and the CVICU or the CCU. And then we also do peritoneal dialysis for those patients that need that.
Okay. Well, how do you handle suggestions and feedback when negotiating changes in your units and improvements?
So one of the things that we look at, we've had in the past a nursing shortage, and so we want to take a look at the nurse to patient ratio and try to make improvements with that, making sure that the nurses aren't not having to experience burnout. The other thing that we do is anything that a nurse or I'll look at in order to improve processes. We'll use evidence-based research in order to try to decrease those incidences where the patients are being readmitted. And also, so we're going to look at continuing education or improved education with our patients, as well as adding communication between the inpatient unit and the outpatient unit. So there has to be a transition for the patient that comes in from the inpatient setting, and especially with those patients that are new to dialysis. So we spend lots of time with those patients so that they transition as best as they can to the outpatient setting. And so where the nurse to patient ratio comes in is a lot of times the nurse is being pushed to not having enough time, and they don't feel like they have enough time with the patient, and that's something that's important to do, because as healthcare reform is changing, and they're going to look at our readmission rates, they're going to look at our patient outcomes. Those are also things that, as a leader, we look at on a situational basis as well as a overall basis, to be able to make those improvements as soon as we can in the unit.
Okay. Well, would you describe yourself as a servant leader, and if so, can you give us an example of your ability to display a servant leader?
Yeah, I think I'm a servant leader. I definitely am in the trenches with my coworkers and involved with patient and very focused on patient-centered care, as well as listening to the needs of the nurses. We implement new technology so that we can improve those patient outcomes. One of the things that we've added to our treatment modalities is CritLine, and a CritLine is something that shows us, it's an instrument that shows us how we're pulling fluid off of a patient that's running on dialysis, and certain patients it can vary as to how that fluid is shifting within their body, and so we're actually able to critically think and make changes to the dialysis treatment so that we're not pulling too much fluid off that patient, or making sure that we're pulling enough fluid off that patient so that we can establish dry weights for those patients as they go out to their outpatient unit.
Well, are there any other areas in the hospital or community that you may be involved in as a servant leader?
Yeah, so there's a the National Kidney Foundation is a foundation that links the patient with health care and with and also connects those patients to other patients that are dealing with renal disease. And so there's the kidney walk that we participate in on a yearly basis, and that kidney walk is something that we participate in, and the physicians participate in it, and the patients do. And we go out there at a local university and do a walk around a lake, and so we get connected with the needs of the patients. The other thing is, in the last 2 years, a kidney has actually been donated to 2 of our patients through that kidney walk, and so that's been a community participation has been a very important effort in our acute care setting. Yeah.
Okay, well that wraps up our servant leader interview. Thank you, Dan, for your time.